Hey guys, I'm Shawn McAnalley.
John Hall.
Hey guys, today we're going to talk about something pretty cool. It's pretty interesting. Well, I guess is it our largest organ? Our skin?
Yes, it is.
Our largest organ, our skin. We're going to talk about skin, apoptosis, all the associated processes that go along with that, like autophagy and maybe some antioxidants or something else. We're going to talk about something like that. But guys, our skin is so important. It protects us. It keeps bad things out. It enables us to catch some sun, to make some vitamin D and things like that. So it's a very, very important organ. And Dr. Hall is going to talk about how we can maybe keep it a little bit healthier. Dr. Hall?
Yeah, and all the time I was growing up, we talked about the two layers of skin, the dermis and the epidermis. Well, now they talk about three layers of skin. So the deepest layer, so there's going to be a little bit of anatomy here, but nothing, there's no pop tests or anything, so nobody has to worry about anything. Everybody gets an A automatically.
Hey. It's like a participation trophy, isn't it?
Yeah.
I got you.
Everybody gets a little drink and gets a little snack or something.
There we go.
We didn't have that back when I was a kid. Mm-hmm. We didn't even get to play sports when I was a kid until I was halfway grown. So now they got for little guys, and that's good, I guess. So anyway, the very deepest layer is the hypodermis, and it's mostly fatty tissue. That's where, when we overeat, that's where the fat's stored. So it's a lot of fatty tissue, but connective tissue too, and that's where blood vessels and the nerves, of course, and then we talk about the dermis in a minute. Mm-hmm. We usually have always talked about the dermis containing the sweat glands, sebaceous glands. Well, the hypodermis does really, and so does the dermis some, and of course things pass through the dermis. But it contains the sweat glands, hair follicles, and lymph vessels and all that. So the hypodermis is the deepest layer, and it tends to be the thickest layer. It can be pretty thin, but it can also be over an inch thick in certain places. And so I remember when you watch surgery, or even just we dissected cadavers for a year in dental school, and did everything. We didn't leave anything untouched. But it was interesting to me how thick the skin was. I was surprised at how thick the skin is in certain places, and so it's pretty thick, and it's important. It protects us, like you said, and that's what the hypodermis mostly is. It's protecting the bones, it's protecting the muscles, protecting the internal organs and all that. It's the biggest part of the cushion, obviously, but it's important. And then the next layer, the middle layer, is the dermis, and so that's what we think of, and then we tend to think of it has connective tissue and all that too. But it's where it has, and sometimes there are just hair follicles there. Not everything's down in the hypodermis, but it contains the sebaceous glands and the sweat glands and hair follicles, or at least they're traveling up through the dermis. And and I should back up. The main cell that's involved with the hypodermis is the adipocyte, which obviously you think in terms of fat. It's or adipocyte if you want to pronounce it that way. So, but anyway, that's the fibroblast is the main cell we think of in the dermis. It's what's producing the protein collagen, elastin, the proteins that are in the skin. But we also have macrophages, some immune cells, macrophages and mast cells, and that's where a lot of the immune response comes in. Well, the fat does too. It's interesting. Almost every tissue, as we learn more, almost every tissue has some sort of immune function to it. Mm-hmm. Almost every cell, it seems like, has some sort, and hormonal too. I mean, so we think of the endocrine system, hormone system, but even the fat cells have hormonal functions, and so do these others. So it's all intertwined. It's really, the more we learn, the more complex it gets.
The more we learn, the less we know.
We know what's going on. It gets really complicated. But anyway, so we have macrophages, mast cells, and mast cells. That's where when you have an allergic reaction or the histamine release and all that. But it's also important in wound healing and protecting against invaders and all that. Schwann cells, those are cells that kind of wrap around the nerve endings, and they didn't know for a long time what's involved, but they're involved in helping the impulse, especially pain, the perception of pain, which is important. We need to know when something's going wrong, you know. So anyway, those are cells that are in the dermis, and of course, their functions of these things are there for, sweat's there for a reason. And sweat helps us regulate our body temperature and all that. I think most of us understand that. And I may have mentioned this before. I always think of this back in 2000 when my son was playing basketball on one of the really, really good AAU teams. They were at the big national tournament in Las Vegas, and it was in July, and it was hot.
Oh my
God, 100 and something, but it was 100 and a lot. And of course it's dry, you know, and the dry air there, and not like it is here. And we were walking in about probably 50 yards on this asphalt parking lot, walking probably 50 yards into the Coliseum, and my son goes, "Golly, Dad, it's so hot and I'm not sweating a bit." And I said, "The heck you're not, you're sweating buckets." You know, because it's working the way it's supposed. Where we live, it's sweat. We just hope some of it drips off, you know. But where I grew up in West Kansas and like that, where it's dry, it works. You know, you sweat and it evaporates and the heat goes off into the air, and that works really well. I told them all of you kids go in there and get a good drink of water, because you're losing a lot of water in this minute of walking through here. But anyway, sweat's important for heat and temperature regulation. And the oil, the sebaceous glands in the oil, you know, it secretes it. It's a barrier. It helps. It helps protect from water loss, but it also helps protect from too much water entering their skin. And we see that, like if we're in the swimming pool or something, or sitting in a bathtub for a long time, you can see the
burning.
There's so you know, but you can't have too much of that, or you'd blow up, you know. So that's important. But so they serve a purpose. So there's some things that the dermis does, and then the epidermis is what we see and what we think of. And the cell of the epidermis, the keratinocyte, that becomes the squamous cells the stratified squamous cells that make up the epidermis. And that's what's protecting us that's the barrier from bacteria and fungus and all that. And you know, it's what we see, and things happen as we get older. So. But that's where the pigment is too, the very bottom layer of the epidermis, the stratum basale. There are 5 layers, and the very bottom is where the melanin is, where the pigment is. And so everybody is different. My wife is really light, I'm darker, and and then it depends on your genetics and your ethnicity and all that. So everybody's a little bit different. But then as you age, things happen down there, down that layer, and you start getting dark spots. You know, careful. You know, and if you're not sure what's going on, all you got to do is do what I do: look in the mirror, and okay, that's what's going on. I see my dad looking back at me, which isn't. That's discouraging enough, but it's my dad shortly before he died of old age. That's what really hurts my feelings. But anyway, things happen that show that we're getting older. And that's basically in the epidermis. So our skin's always exposed to a harsh environment, and so, you know, humidity or lack of humidity. I'm going to go to the mountains again in the summer. It's dry up there, and it affects your skin, affects your mucous membranes, affects everything. I like dry air because I've never gotten used. I've been here most of my life, but I don't like the humidity. Don't like it. But on the other hand, really dry air is kind of hard too. So, but anyway, radiation from the sun, chemical things that we're exposed to all the time, and then of course bacteria and fungus. So anyway, it takes a beating. Our skin takes a beating. And with time, we tend to lose our moisture content. It gets a little bit drier. Things thin out a little bit. The blood vessels thin out a little bit. The interdigitation between the dermis and the epidermis gets a little bit thinner and all that, and we lose the accordion-like effect of the tensile strength. And so it's easier for our skin to tear when we get older. It doesn't take much to bump it, and I'm there now. And as I get older, it's getting worse, you know. But so it's just, that's the way it works.
Yeah.
And then just spots, dark spots and things like that. So, and part of it is the free radical damage. We talk about oxidative stress, and so the skin, the sun is UV radiation is really big on creating excessive oxidative stress, and we call them free radicals, and it's just oxygen radicals. And they do damage, and they go around, they've lost an electron, and they're trying to find, they need that electron so that they're balanced out and everything, and so they'll take electron from anything they can, from DNA, and that's a problem when they take an electron from DNA, because that's not good. That's a mutation then on a DNA, and so that's happening all the time. So, and then just wrinkles and things, and so there are a lot of things happening to our skin as we get older. It gets rougher, a little more transparent, and it's just, you know, it's not as healthy, it's not as strong and young and supple as it was. The turnover, the turnover rate of the skin cells, generally it's 28 to 40 days. When we're little babies, it's really fast, maybe even a week or so. And then as we get into the 40s and all that, it's maybe 30, 40 days. And then my age, it could be up in the 80 days it takes to turn over. Well, the longer it takes to turn over, those cells get older, well, the greater chance things can go wrong. So they need to turn over and they need to be replaced. And
that's an apoptosis word, huh?
Yeah, that's right. That's right.
Yep.
And so anyway, so that's where apoptosis comes in, or programmed cell death. And so it's crucial. Good, healthy apoptosis is crucial to the homeostasis of the skin. So homeostasis is just the balance, the healthy balance. And we want homeostasis in everything, but a healthy balance, because you can have too much of one thing, you can have too little of one thing, of almost everything. Oxygen, we can have too little oxygen for sure. We can have too much. People can die of oxygen toxicity. I always tell people, you don't believe me, just let somebody put you in a hyperbaric oxygen chamber and leave you for a day. Well, the services will be Saturday at 2 o'clock. So, you can have too much oxygen. So you want that balance. That's important in everything, and it certainly is in the skin too. And that's where apoptosis is crucial for maintaining homeostasis of the skin. One of the things it can help do is it can help prevent skin cancer. Because when we get sun, and I've had basal cell a couple of times already, but squamous cell carcinoma or melanoma, you want your body, you want that immune system to catch those cells when they're a single cell, instead of missing them and then letting them grow into tumors and all that. And that's where autophagy and apoptosis and all that comes in. So anyway, but it's easy for apoptosis to become dysfunctional too. And so we see conditions that are associated with aberrant or dysfunctional apoptosis, psoriasis, and there are other things going on, but psoriasis is one of those conditions where you have too high turnover. Cancer is kind of sometimes where the skin's not turning over quickly enough and you're not getting rid of those cells and they can become cancerous. Some of these other conditions like psoriasis is where you have turnovers too high, it's too quick. And so things are happening, and so you have young cells, they're not ready, and it has to be in balance. So it can happen too soon too, it can happen too late, it can happen too soon. And psoriasis, for example, is one of those. And it's just apoptosis, and they know that apoptosis is not functioning. That's not the only thing, but it's one of the things that's happening. It's not working the way it's supposed to. And so, and acne, other things. So some of these chronic inflammatory conditions, and you've heard me say that, I'll say it again, we talk about apoptosis and autophagy, which is the housekeeping function of the cell, where the body's breaking down. The cell is actually taking care of broken down like proteins or whatever, cleaning that up and then recycling those parts into either energy or new proteins, for example. apoptosis, programmed cell death, and then we have oxidative stress and inflammation. And apoptosis and autophagy are really linked together really well. Autophagy basically is part of the repair. When we have damage from trauma or from disease or whatever, then the body wants to repair itself, and part of that is autophagy. If it can't repair itself, then it needs to get rid of it, and that's where apoptosis comes in. And there are lots of other things going on, but those two are linked. And then oxidative stress and inflammation, or the antioxidant effect and anti-inflammatory effect, are linked together. And all four of those are linked together, really, because one of the main causes of, oxidative stress is one of the main causes of inflammation. And when you have oxidative stress, you're going to get inflammation, and chronic inflammation is one of the common denominators of almost every chronic disease. And really, so is oxidative stress. They've been saying that for a long time. Now you're reading where chronic oxidative stress is. Well, yeah, because they're linked together. And when you have that, then you tend to see aberrant autophagy and apoptosis too. They're all linked together. And I'll talk about that when we start talking about foods a little bit that help address this. So, but anyway, and so it's interesting. There are things that happen, and they can affect apoptosis because there are proteins that stimulate apoptosis. There are proteins that are designed to stop it. And there's always that balance, because it needs to happen at the right time, it needs to stop at the right time. Well, sometimes there'll be a condition and it's due to whatever is causing it's stimulating too much apoptosis, it's stimulating those pro-apoptotic proteins, if you will, or sometimes they're stimulating or they're hindering the anti ones, or they're hindering these and they're stimulating the BCLs and all that, BCL2 proteins that inhibit apoptosis. So all kinds of things are happening, and the pathways may be different, but the result is generally the same. Lichen planus is a condition. We see that in the mouth, but you see it on the skin, and you can have erosive lichen planus, where it actually, lichen planus in the mouth, it tends to be itchy if it's on the skin. In the mouth, most people don't even know they have it. You just look in the mouth, and it's kind of pretty sometimes. It's called lichen planus because, you know, the lichen, it's kind of got a lacy look to it, kind of like the lichen that you'll see on a tree or something. It has a kind of pretty, it's kind of pretty, kind of milky, and you look in there and you ask them if they have any symptoms. No, most of the time they don't even know they have it, unless it's erosive, where it's actually the tissue is sloughing off, and then it hurts. But most of the time when you see it in the mouth anyway, they don't even know they have it. But they might also, you also ask them, do you have any conditions anywhere else? Because they usually will, and a lot of times that'll be itching. But anyway, they know that that aberrant apoptosis of the keratinocytes is involved, can be involved in that too. So we certainly didn't know that. I didn't know the word apoptosis until 1992, I think. So, so I haven't practiced dentistry since 1986. So we didn't know about all that. It's been, so anyway, we just knew something was going on. We always know something's going on. We just don't know what's going on. On most things, we don't know what the cause is.
Right.
Just like drugs, we don't know how most drugs work. They just work. Yeah. Something's going on. We just don't know what. But now they're learning more and more all the time. So there's all kinds of things going on. So their target, so now they as they're learning more about it, and of course they're wanting to create targeted therapies, which means drugs. They're trying to create drugs that target this particular pathway or that particular pathway, this enzyme or that enzyme. And you know, I mean, that can work a lot of the times, but a lot of the times, but most of these things, they're complex. There's a lot of things going on. And when you just target one thing, you might get a pretty decent result, but chances are you're not going to. And a lot of times you're going to create problems.
That's what I was going to say. You're going to cause a problem on the other side. You're
creating a problem because you're targeting this one thing, but you're not stopping all the other stuff that's going on. And so sometimes we make things worse, and we're doing the best we know how. But one of the things that we believe in is nutrition, and nutrition, and the idea of food is to help us stay healthy. And that's the reason when you look at dietary supplements, you'll see it says not intended to treat or diagnose or all that. The FDA, you have to put that on there, and it's fair enough, because you don't want to supersede. We need medical treatment a lot of times. We are not anti-allopathic medicine around here at all. I mean, I've always said, if I'm in a car wreck and I'm in about 200 different pieces, well, don't give me a vitamin, take me to the emergency room.
Right.
I had just a week and a half ago, I had a great nephew he had suddenly came down with bacterial meningitis. Well, you can go from healthy to dead in 24 hours with that. Yeah. Well, they figured it out real fast and got him on 4 different antibiotics, and he survived it all. So, don't give him a vitamin. That's not going to get the job done. But the idea of foods is to help us stay healthy.
That's right.
Well, but if we're sick, and I've always said this, and the FDA can't argue with this, if you're sick, a good thing to do is to enhance our nutritional status, though.
That's right.
Too many times people are sick and they're not getting any nutrients. And the same foods that help us stay healthy can help us get healthy.
Right.
And in addition to standard therapy. And so and because a lot of them, they're doing the same thing as standard therapy, they're just doing it maybe not as in a stronger way, because it's designed to catch that single cell before it gets for example, into a cancerous tumor or whatever. But it can still help a lot. And so they've done studies, and so there are a lot of foods help support proper apoptosis. And
you have some of them there?
Yeah, here's some down here. I'm going to skip on down here, but and we know this, and it's the same ones that we think of for antioxidant effects. So vitamin C, vitamin A, vitamin D, vitamin E, because they're all linked together. It's just amazing. Every time almost every single time, maybe not, but 95% of the time, when I'm looking up nutrients that do one or that, they're doing all 4 of those. They're affecting apoptosis, autophagy, oxidative stress, and chronic inflammation. That's the way it works, because they're all linked together. And as I've said many, many times, God's pretty smart. In fact, he's exceptionally intelligent.
I'd say so.
And he's very innovative, and he knows what he's doing. And he gave us foods that the same nutrients that affect one pretty much affect all of them, and help them do what they're supposed to do. And so there's vitamin C and E and A, and so basically the fat soluble vitamins and then vitamin C are well known for their helping with apoptosis. Of course, vitamin A, we know, we've always thought of it as good for skin. We've always, and D, but vitamin A, the retinoids that come, there are a lot of retinoids out there, but they all basically they come from vitamin A, and they're useful, and so they're good for things like psoriasis and acne. I mean, they've been treating that for a long time, topically as well as taking orally, because they really now we know that a lot of us, because they're supporting proper autophagy and apoptosis specifically, is what I was talking about, but they also have antioxidant, anti-inflammatory effects, and so those are so there's a lot of those vitamins, or their analogs, but there's like the polyphenols like in green tea, and and lots of foods have polyphenols, all kinds of polyphenols, and they are then lots of studies showing that they can improve apoptosis of cancer cells, help the body attack cancer cells. Now, again, the idea is when those cancer cells are developing and you have a single cancer cell out there and you want to get it, but also when you have cancer, those are good things to take while you're being treated for cancer too. One of the things they've shown is that a lot of these nutrients help and this is the term they use, they help sensitize those cancer cells to standard therapy. So it's just a great thing to do if you're sick and you're dealing with something like cancer. Get these nutrients in you, and it tends to be like the polyphenols and some of those vitamins, and we tend to be low on the fat soluble vitamins. Almost everybody's a little bit low on fat soluble vitamins, A, D, E, and K, and we need more of those. And curcumin, the turmeric that has curcumin, and they always look at the individual ingredient because they're thinking drug and they want to find the active ingredient.
Right.
And the reality is these foods have hundreds or thousands of nutrients together with others that help those active ingredients work together. They're synergistic. They help protect them from being broken down maybe, and it just makes a difference, and that's being shown over and over again. But anyway, the other thing is, and I'm kind of off base because I'm not talking apoptosis so much right now, but while we're at it, and talking cancer, standard therapy does not, they didn't realize, we knew about the individual cells, but they talk about cancer stem cells. I'm not talking about embryonic stem. I was talking to somebody and I didn't even dawn on me that they would think this. You mean you're talking about embryonic stem cells? No, I'm not talking about that kind of thing. I'm talking about the cell, that first cell that your body produces, that stem cell that produces cancer. They're just called cancer stem cells. They're the first cell, and then the daughter cells become the tumors and all that. Well, standard therapy can touch the tumors, chemotherapy and radiotherapy, but it doesn't touch those stem cells. But guess what does? These foods do. And it's not that and they actually talk about these foods kill the stem. It's not the foods that are doing the stuff. The foods are helping the immune system recognize and get rid of those stem cells.
That's right. That's
And
the key there.
and the other thing they've shown, by the way, is that radiotherapy, every time you get hit with radiotherapy, I shouldn't say, because sometimes they're able to target really, but generally when you're hit with radiotherapy, they're hoping to kill maybe half of what they're aiming at. The problem is they now know, and they've known this since I read this was published in 2012 by UCLA and some other places, cancer centers, but that radiotherapy is actually converting some of those daughter cells back to stem cells that don't respond to chemotherapy or radiotherapy.
Yeah.
So, but I mean, they're kind of between a rock and a hard spot. So then, okay, we know we're creating some problems. But anyway, the reality is these foods address the stem cells. Chemotherapy doesn't, radiotherapy doesn't, but these are. So that helps explain why people can go in remission, and then a few years later, here comes again with a vengeance. Well, we need to be eating those nutrients. They help sensitize those cells to standard therapy and make standard therapy work better, but they also help the body address those stem cells. Yeah. And then get rid of those, and then you get back to where we were supposed to be. We're eating these foods when we're supposed to, and then knocking those out as they develop and not letting them develop the tumors. But that is also tied into apoptosis, because that's how the body's getting rid of those stem cells.
That's right. Yeah.
It's identifying, and then it's using apoptosis to kill those, because those are normal cells. It's not that cancer cells are normal body cells that are mutated, or something's happened to them, and they're not normal cells anymore. It's not like they're just some alien cell. It's a part of our body cell, and but it's not healthy anymore. So our body is designed to recognize those and get rid of them by apoptosis.
And the failure of apoptosis happening is what gets them there in the first place.
And eating the right nutrients. And so as it turns out, there's lots of them, the vitamins and some of the minerals too. But in the polyphenol, but so many nutrients out there, so many good foods out there that we're not getting in our diet. They're bitter. Almost every one of them is bitter. We don't like bitter. We like not bitter, And so the foods that the nutrients that are really helpful with that tend to be bitter. So that's where getting the right supplements because we're not getting the right foods, but we're not getting them, and then with the way they're processed, way they're cooked, stored, and all that, we're losing a lot of that anyway. We're not eating the right foods anyway, and then if we do, we're not getting the nutrients that we used to for. So it's just really important to supplement with the right ones, and it tends to be those nutrients that taste bad, and we don't want to eat them. So, but they're important. They can really make a difference. One of the big things they do is they support proper apoptosis, and that can help with slow down the aging process. We're still going to get old at the same rate, but we don't have to show it at the same rate because it can help our bodies be healthier and help our skin. I get back to skin, help our skin look healthier. If we get to eat those same foods that I was talking about, that helps with cancer, it helps everything else. They can help restore some of the moisture, help reduce some of these dark spots and all that, because it's dealing with those cells that are dysfunctional, that they're showing the signs of age. And so staying away from excessive sun, avoiding the things that are a problem always, and smoking, excessive alcohol and all that, just avoiding I just say to stop doing the stupid stuff.
That's right.
I mean some of it's just stupid, and some of it's just stuff that's that's not the best thing to do. The things I do, of course, aren't stupid.
Oh,
they're just not they're not necessarily the best things to do.
Oh, I got you.
But I mean, I've never smoked, I don't drink, and I've never done drugs, and but I've been known to get out in the sun a little bit more than back when I was younger. I don't so much now. I'm pretty good about protecting myself after being cut on a couple of times. I don't want that anymore. So, but anyway, we need to avoid the foolish things and the things that are damaging, but also we need to do the right things, and that means get the right nutrients in us.
That's right.
However we can. It can really make a difference, and it can help with our skin, and we see that. We see that. And and it's a lot of it has to do with supporting proper apoptosis.
Well, thank you, Dr. Hall. Well, guys, I know that was a lot. I know we kind of went over here and went over there and back and forth a little bit, but hopefully you learned something from that, and hopefully that you'll consider eating a little better, getting some of these nutrients Dr. Hall is talking about, just taking better care of ourselves, because anybody watching this video right now, everybody watching this video right now is getting older. Everybody. Guys, until next time, I'm Shawn McAnalley.
John Hall.
This is For the Health of It.